We have a few minutes for questions, a couple of questions. The minister said, keep the comments short, just
Yes.
a question,
Oh,
please,
yes.
so we don't let others answer.
Minister, thank you so much for your presentation. Paul-André Gauthier, I'm the president of the Clinical Nurse Specialists Association of Ontario. Right now we have a major problem with mental health services, and not only that, the youth and the young people are having so much problems because they cannot access the services. We have expertise in nursing to be able to go to do psychotherapy, and some of our colleagues working in mental health are amazing. But the challenge is about the College of Nurses that has a restriction about the nurse to continue to initiate the psychotherapy and continue to do the therapy. So we would like to ensure that the regulations are put in place in order to facilitate this process and go beyond the limits that the College of Nurses and the laws have been restricting the nurses. Can you help us with that?
Well, absolutely. As you know, we are conducting our consultations on mental health and addictions to make sure that people are supported throughout their life, children, youth, college and university students, through to adults to seniors. And we are looking at ways to expand therapy because we know that there are many people that are falling between the cracks. And the reality is that you either have to pay $250 per hour for therapy if you can afford it. Many people can't. And so they end up waiting on a list to see a psychiatrist because it will be covered by OHIP, but that can take a year or longer. And if you have a son or daughter who's expressing suicidal thoughts, that is not acceptable. So we are looking at expanding psychotherapy by nurses and by others because we know that we need to expand it exponentially. The need is huge. I was actually speaking with one of my fellow members from the other side of the aisle today who was asking me to conduct one of our sessions in his area because they have had a number of suicides recently, including a 19-year-old student. So that's not acceptable. So we look forward to working with you on that.
Hi there, I'm Luella Manning-Kilrankin, President of the Halton Chapter. I'm curious to find out if you could give us an update on your ideas about the LHIN, and whether if there is, the rumors in the media is correct, with the money from dismantling the bureaucracy, move into reinvesting that into the healthcare system, primarily in hiring the 10,000 nurses that are unfilled right now. That is a gap in the system.
Yes, well, thank you very much for the question. I'm not able to speak specifically about the transformative plan that we are continuing to work on. As a matter of fact, I have had consultations with RNAO and received the benefit of advice and guidance from Dr. Grins. But it is something that we want to make sure is going to center care around the patient, connect patients to their healthcare system so that they feel that if they're discharged from hospital, for example, and need home care or are going to long-term care, that they will be connected. Right now, many people feel that they're discharged by the system when they leave hospital and they have to navigate their own way back in to find supports and help. That shouldn't be. It should be a seamless situation for people throughout their lives. We want to put more frontline care into place, and that will necessarily involve more nurses. That's very important.
Great, thank you.
Hello, Madam Minister.
Sorry, Janet is first, and we will
sorry.
those two that are in the mic, and then the minister needs to.
Thank you. Janet Hunt, Middlesex Elgin Chapter. Thank you for being here today with us, Minister Elliot.
Pleasure.
I recently received a phone call from a former nurse, a nurse who was a professional practice leader within the London area and knew the healthcare system extremely well. Her call to me was to help her navigate for her father in the geriatric system. She did not have a care coordinator within the primary care setting, and she was lost. Her father had been on a waiting list for a length of time. So my question to you is, would you commit to relocating the care coordinator function from the LHIN into primary care settings within the next year, please?
Well, again, I wish I could be more specific on the details of our plan, but it will be released very shortly. We are looking at more frontline care, and it tells you that there's something wrong with our system when even someone who knows the healthcare system so well is still having so much difficulty in finding supports for her own family. We need to change that so that people can find their way, that they can navigate the system. It's gotten so complex and so far away from the patient in so many ways that we need to bring it back forward, center it around the patient, and make sure that everyone feels supported and knows where to turn when they need help.
Thank you.
I apologize, I didn't know there was a second microphone. I'm Maria Casas with the Sudbury chapter. Madam Minister, with all the recent negative media coverage of long-term care, the talk about abuse and violence, and attributing this to staffing levels, will you commit to implementing and funding a minimum and meaningful staffing standard for long-term care?
Well, I can tell you that we are taking a look at appropriate human resource levels in all aspects of our healthcare system, because we know that there's different mixtures that are needed in every place, but I would say that nurses are needed in all of them. But it is a concern. We are waiting for the results of the CLEAS inquiry, because I'm sure it will contain some recommendations about staffing levels and safety issues, because we know that there are issues with respect to patient on patient or resident on residents, violence in part related to Alzheimer's and other dementias. There are concerns with respect to staff safety as well. So I think we need to take a look at it from 360 degrees and make sure that we really understand what we need. But we are taking it seriously, we are examining it, and we are coming to some of our own conclusions, but also waiting for the CLEAS inquiry to release its report as well. And we will be taking that report very seriously and into our full consideration.
Thank you.
Last two questions, or you need to... Okay, so let me thank the minister. Sorry, guys. Just to add to the minister comments that yes, we have been consulted. The media has asked me often, are we being consulted or our nurses are not consulted? Yes, we have been consulted. Also on the issue of long-term care, I just recently had a meeting with Joy. We met with the parliamentary assistant to the minister, Efis Rapandopoulos, actually on the issue of both the funding formula that needs to account for complexity and for quality outcomes, as well as the issues of staffing, which are archaic. I think since I came to this country, they have been like that, and that was 1989, unacceptable with the conditions of residents today. Minister, I want to say that is a pleasure to work with you in a different capacity now. We worked with you in opposition, we worked with you as the ombudsman and had frequent meetings, and you came to many of our events as ombudsman, and you brought a very important perspective. And I think to this role as minister, you are bringing also a very important perspective, which is that you stand on your feet on the issues. And I cannot thank you enough for one piece that we already moved, which is the consumption services. These are services that were slotted to be discontinued, if you remember. And I credit the minister working with many of us, RNAO included. And I also credit the premier because he had said no, and at the end he said yes. And when a premier can change his mind on something that he dearly thought it shouldn't happen, they gain respect in the book of RNAO. But you deserve the biggest respect because you were the one working behind the scenes and bringing the evidence, etc. So with that, I thank you. That's for the consumption services. We look forward to hearing good news in terms of dollar signs. For the AGM, which is in April, we started yesterday, we launched the best practice guideline for pre and postnatal smoking cessation as one of the first guidelines with indigenous communities, with women themselves, That work needs to continue. It will be a fiasco if it needs to disband that work simply because government is now taking its time to look at things. So that's absolutely urgent. As it is to move with the issues that my colleagues mentioned in terms of expanding scope, moving the care coordinators to primary care, which, by the way, you were the person supporting that ECHO report that you just mentioned. So hopefully some of those things will come to fruition, and Ontarians will look at services anchored in primary care, wrapped around primary care that are closer to their home. So thank you very, very much.